All right. Well, I think let's go ahead and get started. So, welcome everyone to Educational Modules for AMR Science Communication. I'm your host, Nikki Reynolds from NIAMRRE, and I'll be introducing our speakers today. So, with us, we have Dr. Will Sander, who is an associate professor for preventative medicine and public health and director of the director of the University of Illinois College of Veterinary Medicine. He spent 2 years at the U.S. EPA Office of Water and AAAS Science and Technology Fellow, and 3 years supporting DTRA's Cooperative Biological Engagement Program. He is a diplomat of the American College of Veterinary Preventative Medicine, and he served on their executive board. He serves on the board of directors for the Illinois State Veterinary Medical Association, American Association of Food Safety and Public Health, and the Veterinary Sustainability Alliance. He is the alternate delegate for Illinois to the AVMA House of Delegates. And Dr. Sanders is a graduate of the University of Wisconsin School of Veterinary Medicine, Yale School of Public Health, and Colby College. And then also with us, we have Dr. Emmanuel Okello, who is an associate professor of cooperative extension and antimicrobial stewardship at UC Davis School of Veterinary Medicine. His research investigates the mechanisms of antimicrobial resistant spread, factors influencing antimicrobial use, alternative infection treatments, and the development of rapid diagnostic tools for animal food systems. He has served on various committees, including the California Department of Food and Ag Antimicrobial Stewardship, the African One Health University Network, and the National Academies of Sciences, Engineering, and Medicine's Committee on examining the long-term health and economic effects of antimicrobial resistance in the U.S. Dr. Okello also serves as the UC Davis representative on the NIAMRRE Advisory Council, and he holds a DVM from MACRE and a Master's in Molecular Biology from Catholic University of Leuven, and a PhD in Bioengineering Sciences from the Free University of Brussels. So at this point, I will turn it over to Dr. Okello for the start of the presentation.
Thank you very much, Nikki, for the introduction. Good morning, everyone. We're really happy for the opportunity to share this work with you on development of educational modules for AMR science communication. To start off, we just wanted to give a brief background to kind of set the stage for the work that we're going to present. So just going back to think of antibiotic resistance and antimicrobial stewardship. As we know now, these are some of the most pressing issues in veterinary medicine today. And the key to addressing the challenge of antimicrobial resistance actually lie in behavior change, because we want to change how we use antimicrobials on farm practices like prescribing practices, administration practices, things like commitment to complete the course of treatment. And that's where communication really becomes critical, because to achieve behavior change, we need to communicate effectively. But also, we realize that there are some lack of materials that focus specifically on training veterinary students on effective communication, especially when in relation to antimicrobial resistance and antimicrobial stewardship. So this was kind of the background that set us to do this work. On this slide, I just wanted to step back a little bit and kind of unpack on the challenge of antimicrobial resistance. So it's really not just a one problem, it's a multifactorial problem that encompasses factors relating to behavior. For example, if you think of the way we use antimicrobials, the prescription, those are kind of behavior-related practices, but also there are systems-related challenges. For example, awareness, education, and training, the regulation, those are some of the system-related challenges. And all these build and lead to the outcomes that we see, like prolonged illness, intensive treatment, healthcare cost, And ultimately, all these factors kind of channel down to the impact that we see, which is the reduced effectiveness of antibiotics. So our response to the challenge of antimicrobial resistance is really antimicrobial stewardship. And looking at the definition at the very basic, we know that antimicrobial stewardship refers to the action that veterinarians take both individually and also as a profession to preserve the effectiveness and availability of antimicrobial drugs in the long term. So here we see that the veterinarians are uniquely placed to influence how we use antimicrobials and promote stewardship. One of the ways is by dispensing and also providing oversight on the direct use of antimicrobials, especially medically important antimicrobial drugs, both in food animals and also in companion animals. But also importantly, the veterinarians also make a vital link, a bridge between animal health and human health, and that's in the One Health space. So looking at science communication itself as well, at the very basic, we would think of science communication as translating complicated scientific concepts into forms that are easily accessible to our diverse audience. Most of the time, we have audiences with varying level of scientific knowledge. So science communication helps us to unpack this knowledge and put it in in a way that is easily accessible and actionable by different audiences. So there are a few characteristics of science communication that we should think of. It has to be not only clear but accurate, but also has to be engaging and relevant, because the ultimate goal is to transmit knowledge and also foster understanding with the goal of influencing decision making. And when you think about veterinary medicine, the decision making by the producers or by the farm workers or the pet owners, the decision to kind of commit to following the treatment course and completing the treatment course, or the decision by the veterinarian also to prescribe the antimicrobials. And when it comes to the side of the veterinarians, normally they are making decision in the context of the client expectations. So it's kind of a situation where they have to navigate and communicate so that everything goes smoothly. And on this slide, I've highlighted some of the the challenges that we see in communication, especially related to antimicrobial resistance and stewardship. In any science communication, we're always trying to simplify the information and make it accessible to the audience. But the challenge is sometimes we risk oversimplifying the information and we lose the essential detail, the content, the knowledge. So we need to kind of strike the balance between simplifying the information, but also not losing the essential knowledge, essential detail of the information. Another challenge is using appropriate channels. So communication is not just passing the information. It kind of relates to when you pass the information, how you pass the information. So we're thinking about different communication channels, like can have one-on-one conversation, or you can use media platforms, or you can use print media. So all these, you need to think about how to package your information and use the appropriate channels so that you can achieve the intended goal. Also tailoring the message to the different audience. As you said already, in veterinary medicine, we have different audiences with different backgrounds, different priorities and expectations. So always when you're packaging the message, you have to have your audience, the specific audience in mind so that you achieve the intended goal. And the other challenge is explaining uncertainty. In science, as we all know, we deal a lot with probabilities, also uncertainty. Sometimes we are dealing with evolving science where we're still working on getting the ultimate solution. But still, we need to communicate this information in a way that we explain the uncertainty, but we don't lose the trust in the audience. They still believe what we're explaining. So that brings us now to the goal for this curriculum development project, which was basically to develop educational resources that would strengthen science communication in veterinary medical education. And as a team, we used a three-part approach to the curriculum development. So these are the three phases that we looked at. In phase one, we did the needs assessment, trying to find where the current knowledge is, the practices, the information available, and then use that information to build the modules and test the modules with a select audience to make sure it's relevant and accurate and usable. And then in the phase three, we focus on the dissemination of these modules to make sure it's widely accessible to both the students and also the veterinary medical educators. I'll dive in a little bit into phase one. So in phase one, we conducted two complementary needs assessment. In the first phase, we did focus group discussions, which included a total of 74 participants. And this included both faculty members and students from three veterinary colleges. And these were the Iowa State University, UC Davis, and also University of Illinois. So these discussions kind of gave us opportunity to understand the participants' experiences with AMR and AMS training in the veterinary curriculum, and also understand some of the gaps and the challenges that they see. And based off the information that we gathered from the focus group, it helped us to design a national survey for the veterinary medical students across the US. So in that, we reached out and got a response from a total of 461 students from we sent the survey to 33 veterinary medical programs, but we received responses from at least 16 schools. And the survey gave us opportunity to kind of broadly understand the current knowledge, the confidence of the students, and also their motivation about AMR and AMS practice and science communication in their future professional practice. So looking at the survey, it comprised of several sections that was trying to kind of from one end get the perceived competence of the students, especially relating to topics of AMR, AMS, and antimicrobial use. And also we use the Likert scale measures to gauge the level of confidence of the students and how they agree with some of these concepts. On the others, another component of the survey looked at the communication skills training. I tried to see what training the students have been exposed to, the effectiveness of such communication and opportunity for skill improvement. And also we used numerical sliding scale to kind of get direct measure of the science communication skills of the students and also assess their knowledge. And then the last section looked at science scenario-based question, kind of to give the student opportunity to express themselves how they feel about the real life application of antimicrobial use and stewardship, and how they go about solving problems related to communicating AMR and AMS. So on this slide, I just wanted to give a snapshot of what our respondents population looked like. We had respondents from all 4 years of the veterinary program, but we could see that most of the respondents were from actually the first and the second year students. This kind of show that our data is a little bit weighted towards the early stage learners, but still we had responses from all the 4 years program, students from all the 4 years of the DVM program. So this also gives us confidence that we've actually captured the entire breadth of the gaps and the challenges across the entire DVM program continuum. This slide kind of gives just a snapshot as well of the kind of exposure that the students, the respondents indicated they have had with regards to communication skills training during their veterinary medicine training program. So we see that um, mm, with there were there were there were some students that did not that would say they had not yet received the communication skill training, especially in the first and in the second year. But as you go along towards the final year, the third year, and then the fourth year, all the students indicated that they had received some form of communication training. But also, if you look at the type of training that they were receiving in the lower section of the table, you'd see that mostly it comprised of lectures and simulated consultations. So the majority of the students receive, like especially in the early years, first and the second years, and simulated training was more reported in the final year students. But the striking thing is that none of the respondents indicated that they'd received online training, and this kind of gave us the knowing that there's actually a gap that exists to include this kind of modular training into the program as a supplement to the veterinary training program, and it would be good to introduce this earlier in the training in the veterinary curriculum, so that as they go along through the program, they build on those skills. This slide gives another snapshot on the perception of the students if the training had prepared them to make informed decision when choosing an ideal antimicrobial for an individual patient. What we see here is that from the bottom with the first year students, there's some lack of confidence. Especially, we see a lot of the neutral and disagree, somewhat disagree and disagree. But as you go along and the second year, third year, and in the fourth year, you see more level of confidence building. So you see more somewhat agree and strongly agree, especially if you look at the top bar with the fourth year student. So what kind of we glaze from this is that um, the students build confidence over time with the exposure. So by the time they get to the fourth year, they have more confidence. So it's a good thing, but also again brings us back to the opportunity to kind of introduce this. If students are introduced to the training early enough, so we have the opportunity to build even on these skills more as they progress towards the the final years of their training. And on this slide, we just show kind of a general understanding of the students on how to make decision on using of antimicrobial drugs given the different kind of scenarios. So the emphasis is not on the individual cases, but more on the general pattern that we see here. We see that for cases, for scenarios that are more direct, students showed more confidence in making the decision to do empirical treatment. But then there's some ambiguous cases or cases which are not clear cut that we see a lot of variability. So this variability also gives opportunity for us to kind of reinforce the training and the skills, the communication skills, again, in the context that antimicrobial use kind of, we have to understand that this would be some expectation from the clients or some pressure from the client as well. So communication becomes really, really critical. And to go back and summarize what we got from the phase one, we learned that students received good technical information on AMS and AMR, but the communication aspect is varied. There's more confidence as students move along the training program. They get more exposure and more confident with the ability to communicate. But also we could see that there was no specific training that is targeting really just the aspect of antimicrobial resistance and stewardship. Students do get communication training, but more in a general sense of science communication, but none which is targeting specifically AMR and AMS communication. So with all this, kind of gave us the confidence that there's need to develop a curriculum that would address this gap. And we use this information to go ahead and build the curriculum. And at this point, I will pass it to Dr. Sander to go through the next phases.
Great. Thanks, Dr. Okello. So hopefully that gave you some good background on where we came from and then where we launched into for module development here. So go ahead, next slide then. All right, so the phase two, we talked about, Emmanuel talked about earlier, the 3 phases that we've approached this research project with. Phase 2 is modular learning. So this is where I finally put the rubber meets the road. And we tried to put things into practice here. So we wanted to apply the findings we took from the survey as well as those focus groups and develop some student proficiency and effectively communicating complex scientific concepts to a diverse audience. So while the purview was really around antimicrobial resistance and stewardship, we really wanted to make sure that a lot of the communication training that we were providing could be used in other complex scenarios too that you often have to navigate with clients in a veterinary space. So again, most of our examples throughout the modules, we wanted to stay within the AMR, AMS space, but this was one of the big tenets we wanted to keep in place throughout. And then also navigating the emotional nuances of animal well-being discussions and managing how emotions happen, what preconceived notions come into a clinical setting, all those sorts of things. And so we worked with an outside third-party provider called Vivaic, who utilized the Articulate platform. I'm sure some of you are familiar with Articulate and using it for educational module development and other spaces like that as well. So go to the next slide. So these are the 4 modules, and we really wanted to make sure that these were, practicing good adult-based learning principles and keeping them short. And so really not wanting to exceed much of 15 minutes. And we wanted to keep it all within an hour. So we distilled it down to 4 modules. And I think a lot of us in the academic space could certainly go on for hours and hours about these topics. And so this was a good test in itself around communication strategies. But these are the 4 modules we distilled it down to. So we really wanted to ground everybody in the same knowledge in module 1 around AMR and professional and social settings. What does it mean? What is AMR? What is antimicrobial stewardship? And what are antibiotic residues? All those sorts of things. We wanted to make sure people had a good understanding of what that was. And then module 2 is delving into communication science. Module 3 was then walking through several different types of scenarios. And so this screenshot here on the right is from module 3 and thinking about these different spaces in the veterinary clinic. This is a small animal, companion animal example, obviously, where you can intervene around communication and different scenarios that can come up where, the client service representative or front desk person can provide reinforcement information on antimicrobial resistance or stewardship, in the exam room, in the hallway upon greeting, around preventive practices. And then module 4 was thinking about future communication strategies for antimicrobial stewardship. So reviewing the pieces that we covered in modules 1 through 3, and then delving deeper into what is your ongoing plan as a learner to keep pushing forward these strategies. So next slide, please. So again, module 1 was, again, grounding everybody on what antimicrobial resistance is. And we had a lot of debate internally as a team around antimicrobial resistance and antibiotic resistance, because we all know the term AMR, at least anybody who works in this space. But a lot of what we discuss, especially with our veterinary students, is really antibiotic resistance. And so we wanted to make sure there was clear definitions about antibiotic resistance versus antimicrobial resistance and some examples around that. How does this occur? Defining those antimicrobials and antibiotics. And then lesson 2 is antibiotic stewardship within this module and really walking through the AVMA judicious use of antibiotics 5 steps that exist out there and what those are. And then lesson 3 was, and then building on that was actually providing some practical steps. So not just kind of these general steps that are good practice for AMS, but actually some practical steps as examples there. And then lesson 3, because a lot of the client interaction sometimes is around confusion between antimicrobial resistance and sometimes things like antibiotic residues, which we talk about in food animal spaces and obviously at the end product for what we consume for animal protein. And so we wanted to make sure that was explicitly cleared up for the students, which we also found students sometimes found to be confusing in our survey results, and provide some good definitions there. And then lesson 4 was, again, reviewing it and putting it into practice. So what, again, are some practical steps around antimicrobial stewardship as example? Next slide. Module 2 is then, again, around communication science. So what are the tenets of science communication? And, we relied on the whole team, but in particular, Andy King, whose sole focus is not veterinary medicine, but actually communication science and communication academic spaces. And so, those tenets of translation of complex knowledge, balance of simplification and accuracy, approaching diverse audiences with different backgrounds, multiple communication channels. So not just, active communication, but also passive communication transfer, all those sorts of things. The evolving nature of science and the uncertainty that we have going along with that evolving nature of science, and the multifaceted goals that we have in any sort of exam clinical encounter, right? So it's a big piece to cover. Lesson 2 is really best practices. And so we broke that down into basically 3 steps around listening attentively and communicating professionally. Step 2 around adapting communication style to diverse audiences. And then step 3, preparing documentation and forms for the intended audience so that they have some sort of reinforcement material when they get out of the exam room or the clinical scenario and they've forgotten everything, all the miraculous, intelligent things you've told them in that exam encounter, right? So having those pieces of documentation in place. And so we really wanted to break those pieces apart and then think about some frameworks that already exist out there for these communication strategies of how do you break this down. So one of them is here on the right, this acronym SODAPOP. And so this stands, as you can see up on the slide, for source. So identifying the source of infection, organisms, so determining the organism likely causing the issue. D, decide to treat whether treatment is necessary or not. And antimicrobials or antibiotics, consider if antibiotics are actually needed. And then patient, considering the individual patient's health, history, and circumstances. And then options, making sure you're discussing all the treatment options with the client so they feel informed and empowered. And then the plan, obviously developing and implementing a plan. And then there's also the acronym out there, GET SMART, which is used often in human clinical medicine around gaining trust, empathizing, taking time, sharing findings, making specific diagnosis, articulate what's next, resist unnecessary use of antimicrobials, and treat. What sort of treatment options do we need to consider beyond just antibiotics as well? And so those are the big pieces we wanted to try and walk through in the communication strategies and make it very AMR, AMS specific. All right, next slide. Module 3 is about how we walk through various challenging scenarios. So we provided, lesson 1 was what would you do? And this is really walking through large animal and small animal scenarios. So we really wanted to make sure, I think a lot of antimicrobial education pieces certainly focus a good deal on small animal spaces, companion animal spaces, primarily because a lot of our students go on to practice in those spaces. But we want to make sure we had real tangible examples in the large animal or food animal space. And we wanted to also set this up as kind of a select your own adventure, right? So how do you select the communication strategies as you see in lesson 2 there? Like, all right, well, I want to do this. All right, what happens next, right? And so we had, as you can see from the screenshot here, these kind of breakdowns as different prompts and interactions came up about what would happen next. And really having students think about implementing what strategies they wanted around using clear and consistent language and terms, avoiding medical jargon, and providing practical examples that resonate with the client's experiences, right? So that the client doesn't feel like they're overwhelmed with scientific jargon without actual real tangible ideas of how to do this. And in the review piece, we wanted to reemphasize kind of how you go about tackling these challenging scenarios and think about two primary approaches, one being meeting the listener where they're at to validate their concerns while introducing another approach, potentially, if their approach might not be the ideal one that you're looking for them to do. And then two being providing clear direction on complex concepts. And those things, we all get better and better at as we have more and more of these types of interactions. But it's really important in any clinical scenario, regardless of antimicrobial resistance or stewardship concerns, to practice these primary approaches about validating the listener and making sure you provide clear direction. Next slide. So in the final module is the future communication strategies for antimicrobial stewardship. And so we revisited the stewardship principles that were outlined in module 1, as well as revisiting the communication approaches outlined in module 2. And then we provided additional resources too, because many of you are very aware of a lot of these resources, but Ohio State has some great resources in small animal, equine, and food animal spaces. The American Association of Feline Practitioners, now the Feline VMA, in conjunction with AHA in 2022, had released their own antimicrobial stewardship guidelines for companion animals. There's some great literature out there. We provided one great example we felt for the recent literature around implementing antimicrobial stewardship across 135 different general practice clinics. And then advice from the American Association of Bovine Practitioners, we also included in those resources too, so that bovine practitioners had a good spot to have this more zoned into what they're practicing in. And then we also provided an example, an actual recorded example of a practitioner and a client communicating with empathy, and how do you try and meet, again, the listener where they're at, empathize with them, and try and come up with plans moving forward, including presenting alternative treatments. So this is an example here on the right, a screenshot talking about, a dog coming in with diarrhea, acute onset diarrhea, and talking with the client about, all right, well, we can try these things, right? And what things should you more likely want to do versus do something else, right? And so this is getting away from just jumping to metronidazole or some sort of antimicrobial and thinking about bland diets and evidence and how you can try and manage this situation. And then towards the end of this module, we wanted the learners actually walk through typing in their personal plan for continuous improvement. Now, this isn't necessarily assessed for the learner, but this is a great way for them to think through, all right, these are the things I want to keep on my radar moving forward as I finish my veterinary training, as I move on into practice, for example. Next slide. And then more recently, we've developed in this last few months a supplemental activity guide. And so again, to make it as easy as possible for those of us teaching, providing additional tools. And so these are prompts that are set up for different levels, whether it's a first year novice level course or second years, advanced beginner level in the second year or into the third year or clinical year, or competent level trying to apply practice. And we have various different setups here around a knowledge check quiz or simple exit reflection versus something like an introductory activity that you can do in class and scaffolded practice with small groups versus something more intense like responding to mini scenarios and really walking through a more of a time-intensive setup for the competent level. And so this supplemental activity guide is also available for educators to utilize and implement as you feel like would be useful. Again, just trying to make it easy to pull off the shelf because the modules are already set up to be easily imported into any LMS. So it makes it really easy. I've utilized it at University of Illinois as teaching in our second year curriculum here and putting it right into our Canvas, which is our LMS at University of Illinois, and it works seamlessly as far as that goes. So again, this activity guide is just another thing for the educator to have as a tool set to pull on to say, hey, I want a quick question to put into the beginning of my PowerPoint slide talking about this in class, or I want to do some sort of online discussion on your LMS, and you can have prompts that way. So that's the idea behind this activity guide. Next slide. And so as Dr. Okello mentioned, we piloted these modules over the last year plus now across these institutions and asked students who went through to actually fill out a survey afterwards. And we had some pretty good responses to that. And then the goal is obviously, as part of this webinar and other spaces too, is more broadly disseminate this to other veterinary colleges across the United States. Again, something that we're free dissemination as part of the grant from USDA, that we're trying to make sure this can get out to as many people as possible and be as useful as possible too. And the future goal is potentially to disseminate this to graduate veterinarians through RACE, for example, and have this be a resource that can be utilized, because I think all of us can continue to learn in the antimicrobial resistance and stewardship space. Next slide. So this is what we found from our pilot data so far. And so we had 430 students across different years. Most of them are just years 1 through 3. We really didn't have any 4th years in these pilot stuff, because a lot of this was implemented through classroom work. And they had self-reported knowledge bases, right? So many of you, I'm sure, are familiar with pre and post surveys. And so we had some great feedback from this. And so we're still in the process of analyzing the data on this, but overall trends, we're finding the biggest gains really coming from applied knowledge or specialized concepts, rather than just general AMR, AMS knowledge. And so thinking more about these effective communication strategies and tactics, really practical, tangible steps for preventing antibiotic resistance, and then core principles for creating an antibiotic stewardship plan. And so this QR code takes you to the education page on NIAMRRE, which has a spot for getting access to these modules, but also thinking about other education pieces as well that are available. Next slide. So we want to acknowledge the project team, Paul Plummer, Andy King, myself and Emmanuel, Amanda Croder, who's graciously taken on as principal investigator the last couple of years of the project, Sarah Smith and Madeka Kajal, who all helped facilitate this, as well as our USDA NIFA funding. Next slide. And then the last slide here is, again, if you're interested in accessing these modules, this QR code will take you there. You're also welcome to email either myself or Emmanuel, and we can get you connected too and make sure that you can get access to this information. We're happy to disseminate this or answer further questions afterwards on this chat here or via email. And then last slide is just promoting the NIAMRRE conference, which I'll turn back over for our host for this panel discussion here, because the conference is coming up in just a little over a month away, and it should be fantastic over in Ames.
Thanks, Will and Emmanuel. Great conversation and great resources that you guys have created in AMR and science communication for this sector. So yeah, our NIAMRRE conference is coming up May 19th through 21st in Ames, Iowa. The conference moves around the country, and this year it's in Ames, and we're happy to have it here. It's 3 days of conversation, networking, panel discussions, hands-on workshops, all related to antimicrobial resistance and bringing together stakeholders and experts from all sectors. So animal health, human health, plant and environmental health, as well as stakeholders from academia, industry, government agencies, and nonprofit supporting entities. If you've never been, our conference is filled with very open and kind and friendly people. So come and join us, and I promise you'll fit in. If you'd like to register, our early bird pricing actually ends today, but you can still sneak in and get that discount. Otherwise, regular registration rate is open throughout the rest of the time until the conference. If you're interested in topics like communicating technical jargon, we do have a hands-on workshop for communicating these types of conversations to lay audiences and non-technical people, as well as we have hands-on workshops in stewardship and education and extension. And we'll be touching on topics like innovative solutions and tools and technologies related to AMR, as well as the economics of AMR, policy and regulation, and research across sectors. So we'll hope you'll join us. Go ahead and scan that QR code. At this time, we'll take questions. I see we have a few in here. So the first question related to the presentation today is, did the question for students regarding exposure to communication training define communication training? Was it with media, news, or with clients in a clinical setting? Will or Emmanuel, could you answer that question?
Sure, yeah, I put a brief response in the chat too, but I think, we really didn't define it specifically. Our subsequent questions on communication were all based on clinical spaces, and so it wasn't around media or, outside social media engagement or things like that. It was really in the clinical space. But that is a good prompt that we probably could have specifically defined in that question for clarity for the students.
And here's a note from Dr. Kruder. She says Race CE is already available and can be accessed through the NIAMRRE website, which is true. So if you go to their website, niamrre.org, and the education, you can access that there. Also, you can access it through the link that we'll put up in the chat. And then if you want to move back to the QR code for the modules, we have some people asking for that information again, and I'll put the conference in the chat too. So any other questions from our attendees?
There was one other question I saw in the Q&A, I think, around, well, two other questions, I guess. One was around what year in the veterinary curriculum that you think would be best for deploying these modules. And it looks, I think most of us in the pilot space used it in the second year of the curriculum, and I think it fits for a lot of us because a lot of us cover pharmacology and bacteriology and things like that in the second year. And I also think it fits well for getting people early exposure to communication strategies before they get down the road into clinics and spaces like that. So I think second year makes and then Amanda did, Dr. Kruder did third year curriculum as well. So, I don't think there's a wrong spot to put it in. It is broadly applicable. I think, like you said, it's obviously available for race too. So I don't think it's limited to just veterinary students that can get some good input from it. I do think it's nice having some good grounding underneath you a little bit before jumping into the modules. So I think second year or later would probably be a good spot for it in general. And then I saw the second question, or the earlier question in the Q&A, I think, was around developing online games. Has anyone tried developing online games as an approach for communicating about AMR? I don't remember coming across that at all in the literature. We did not go down that pathway at all. I don't know if Emmanuel, if you remember seeing anything along that.
No.
Yeah. I think it's a great idea, though.
Well, I don't see any other questions coming through at the moment. Thank you to everyone who joined us today. And hopefully we'll see you at the conference, and we'll also be chatting with you about how you can incorporate these modules into your curriculum and into your everyday jargon. So thank you for joining us, and have a great day, everyone.